Good afternoon, everyone. We will go ahead and convene our informational session. I am Senator Saud Anwar. I am currently serving as the chair of the Children's Committee and acting chair of Public Health Committee. I represent the 3rd Senate District, including the towns of East Hartford, South Windsor, Ellington, and East Windsor. I wanted to just have a brief remarks, and I'll have my co-chairs also have a brief remarks, and then we'll just go over a few things. We have some of the members over here, and then I know many are on Zoom. I wanted to thank each and everyone who is joining us and all the panelists who are joining us as well. When a child is hungry and cries because of the hunger, the impact on the parents is immense. It is one of the most anxiety-provoking situations for any parent. Last few weeks, thousands of parents experience this anxiety in our state, and this anxiety, concern, and fear may have been even higher for the children who have metabolic disorder or an allergic condition, and the food that the child needs to survive, if that's not available. If it is available, it's very expensive. All of that has led to a very significant concern across our state. So dear parents, guardians, grandparents, we heard you. We hear you. We have heard your concerns and your pain. And today the Children's Committee and the Public Health Committee have put on this educational conversation or informational session to make sure that you have an opportunity to hear from some of the expert pediatricians in our state, but also learn directly from Senator Blumenthal, who is in Washington, D.C., and who's going to join us from D.C. and share with us the current situation and the solutions that are being looked at. We will also hear from Attorney General William Tong's office and also members of the Department of Public Health and members of Connecticut Food Association to hear about the ground realities and the next steps and make an immediate and intermediate and long-term plan. I wanted to thank the Public Health Committee's Administrator Beverly Henry, who has organized this in a very fast fashion, and today is her birthday, and then she's been kind enough in our birthday to be here helping us out, make sure that all our children are safe, and also make sure that we have a plan and educational effort for our families. And also other members of the Public Health and Kids Committee who have been here. With that, I wanted to ask my co-chair, Representative Linehan, to make a few comments, followed by my co-chair, honorable co-chair, both honorable co-chairs, Representative Steinberg for Public Health to make a few comments as well. Go ahead.
Thank you very much, Senator. I appreciate that, and I appreciate the thought with which you put into this in this forum. As the co-chair of the Committee on Children, we have done quite a few of these forums, specifically for the purpose of educating parents when there's been an issue. And so I do appreciate the opportunity to continue to educate parents in this regard, because as many of you have seen, there have been a lot of memes on social media saying ways to possibly feed your baby during the shortage, and they could be dangerous, and we're very concerned about that. And I am consistently hearing from constituents who are concerned that they don't know exactly the best way to work to find formula for their child while this national shortage is continuing. And so in addition to all of those great folks that we heard about who will come on and discuss the national response and the state response, I'm really happy to say that in addition, we also have some pediatricians here who are going to talk about how to safely bridge the distance between a shortage now and until such time that the formula does get back on the shelves. And I think that this practical advice is going to be really important for parents. So for those who are watching and for our colleagues who are on this call, I think you're going to also have a great deal of good information that you can share with your constituents about actionable things that they can do right now while there is a shortage on the shelves. So thank you very much for allowing us the opportunity to be here, and I look forward to hearing from everyone.
And Representative Steinberg.
Good afternoon. First of all, before I say anything else, I must wish Bev Henry a happy birthday, because if I forget that along the way, I will pay for it Happy birthday, Bev. I hope you get to enjoy part of the day, even if it's not the next hour and a half, quite in the fashion that you intended. Secondly, I want to thank Senator Anwar for putting this together. It's important that what we do is timely as well as informative. And now is the time for us to have this conversation. There's a general feeling of powerlessness. This is not something that we can really solve at the state level. And it's wonderful to have Senator Blumenthal with us to talk about the federal remedies. But I also think that it's important for us to acknowledge the immense stress on families, not as if any family needs additional stress at this point. It's a challenge for us as a community. What is it that we can do to pull together, much as we did during the early stages of the pandemic, to help one another? And I think that this is the kind of conversation we need to have now, perhaps even contemplating thinking outside the box, because it reminds me a little bit of the circumstances around the crisis response we had to storms. We know storms are going to happen. We have a crisis protocol in place, and we're able to inform people and help people often in advance of it becoming really critical. I'd like to think that we can identify essential commodities and resources such as this. There could be a diaper crisis at some point. And what is it that we are prepared to do as a government to help people cope, to help them get through it, to find the requisite resources to deal with it? Sometimes there may be a substitute product, other times there might not. But our job as legislators is to shine a light on this, have a conversation with the experts, and see if we can do better next time. See if we can be more responsive to the reality that something like this could happen again, and more nimble in terms of our ability to help people going forward. Thank you, Senator.
Thank you so much. I know some of our speakers are on a very tight timeline, so I'm going to be juggling a little bit with the agenda because of the timeline changes that are happening. So I wanted to see if we can have Senator Blumenthal, who is in Washington, D.C., to be able to give us an update from D.C. and then from the federal perspective. Senator Blumenthal, welcome and thank you.
Thank you so much, Senator Anwar. Thank you to you and all of the other leaders on this call. I am sorry that I'm not with you in person, and I appreciate your accommodating my schedule. We do have votes that begin at 4 p.m. and I will stay on as long as I can. But let me just thank you for taking the lead, all of you for taking the lead on this important, critically important topic. And I want to just begin where Representative Steinberg ended. There was a crisis in infant formula before the close of the Sturgis, Michigan plant. Abbott's plant was a major source of infant formula for consumers, but on many store shelves, infant formula was in short supply. It may have been 20% or 30%. It's now at 40% out of stock. And we need to address those long-term reasons for shortages. I want to just go straight to what we're doing now in the Senate and in the Congress. We are pressuring the FDA to move even more quickly. The opening of the Abbott plant in 2 to 3 weeks, I think, is the present projection. Good news, good start, but there need to be additional oversight to make sure that plant delivers product as quickly as possible. Getting those production lines active and making sure there are deliveries is a job the FDA needs to undertake. I've advocated using the Defense Production Act because the shortages that exist right now can't be overcome in 2 to 3 weeks. It will be longer. And I believe that the president ought to invoke the Defense Production Act, which will enable some of the production lines in other companies to expand. As you well know, there are 4 major companies in the United States. They are responsible for 90% of the infant formula. Those companies are Abbott, Mead Johnson, Gerber, and Perrigo. And the use of the Defense Production Act could enable more product to be available more quickly. Second, there need to be tariff adjustments and labeling waivers to permit more imports. Foreign product is as safe as ours. In fact, the argument has been made that it's safer. And the experience at Abbott with the bacteria contamination supports that argument. More imports will increase supply here. Prices have already increased so dramatically that I think that the imports will be forthcoming if we open the markets to them. Third, I've written with Rosa DeLauro to the FDA to not only encourage the steps that I've mentioned already, but also to the FTC with her to urge more effective and widespread enforcement against scammers, offering refunds, for example, for return product when there are no refunds, or the frauds that exist out there. They are growing in prevalence. You've probably been made aware of them by your constituents, promises of product that may not be delivered, or it may be substandard. And the price gouging that is beginning to occur ought to be pursued at the federal level. I recognize well, because I served as AG, that Connecticut's laws are limited in terms of what's permitted in the way of pursuing price gouging. The AG's office is doing an excellent job on gasoline sales because of the authority that it's been granted by actions by the governor. And I know you're going to hear from Cara Passero and Jeremy Perlman on that topic. And thank you and AG Tong for all your good work. But the federal government, the FTC, can do price gouging enforcement. Now, I'll add that I'm proposing measures that will increase the authority of the federal government on price gouging. We need federal authority strengthened. And I'll be introducing a bill with support of my colleagues in the Senate to increase enforcement on price gouging. Let me just say finally, because I mentioned the long-term problem of consolidation in the industry, responsible for 90% of the product, and in some states, almost all of these sales under the Special Supplemental Nutritional WIC program, Women, Infants, and Children. I'm not going to belabor the details here, but the federal government, in effect, has added to the consolidation or concentration of power problem by the way it's administered sole source contracts through the WIC program. 50 to 60% of all infant formula is paid for through the WIC program. So this is a major impact on the industry. We need to stop sole source contracting when it increases concentration in the industry. Competition is key to good prices and adequate supply. And there needs to be more effective enforcement at the federal level of competition policy that promotes this kind of competition that enables more supply. So again, I just want to thank all of you for your commitment. I think that we can do a lot in these areas to speed manufacturing, enable more imports from Mexico, Ireland, the Netherlands, Chile, also stop the frauds and scams and price gouging that are spreading, and most important, get to individual consumers the product that's definitely and urgently and desperately needed by their infants. And it's not a luxury, it's not a convenience, it's a necessity. In conclusion, thank you. Anybody who hasn't visited the diaper bank, just linking my remarks to Representative Steinberg's comment about diapers, all these kinds of products, whether it's diapers, infant formula, are really a matter of, in some sense, social justice and equity and caring for our children. And that's a bigger topic, which I hope we can continue to discuss at some point. Thank you, Senator Anwar. Thank you, Representative Steinberg, as well as Senators Summer, Huang, Representative Pettit, and to Liz Linehan and Kevin Kane and Dalpanis. Thank you so much for your leadership. I'm proud to count you as colleagues and friends, and just wish I were there in person. Thanks so much.
Thank you, Senator Blumenthal. Senator Blumenthal, if I may ask you a question, a quick follow-up. I know you have limited time, but I wanted to see from a long-term perspective, the fact that 3 companies control 90% of the market share, that's somewhat of a vulnerability in the situation. Any thoughts of how that can be addressed in future?
Great question, and vulnerability is exactly the right word. The reason we're in such trouble right now is largely due to that vulnerability. Abbott accounts for 40% of the nation's supply, which is a searing indictment of our competitive posture in the United States for infant formula. The fact that these percentages have grown to that level, in part as a result of government policies, is unacceptable. So I think more effective use of government contracting through the WIC program to encourage more competition, more entrance to the market, a longer-term solution. We need to be innovative and creative in the way that we promote competition, because this monopolistic dominance creates that vulnerability. And I would be delighted to talk with you about more specific steps, because I think Connecticut can help take the lead. As Attorney General, I enforced antitrust policy. William Tong has been extraordinarily active and activist in his use of that policy. And I think our legislature could also play a role. But as you know, antitrust law is enforced not only by the federal government, but also by states.
Thank you so much, Senator Blumenthal. And I would just request, Senator Blumenthal, after your vote, if you have an opportunity, please log in again. I know my colleagues have questions as well, but I also know that some of our members of the Office of State Attorney General, they have another meeting. So I wanted to give them an opportunity to speak. And when you have your vote, would love for you to join back if your time allows.
I will definitely try to do it, but I'm happy to yield to the Chief Counsel and Associate Attorney General of the Attorney General's office. And thank you so much again. Really appreciate it. I'll try to log back on, but I see a lot of my friends, a lot of people I miss on the call, and would love to be back with you. Thank you so much, and really appreciate this opportunity.
Thank you so much, Senator. And with that, we will have Cara Passaro, who is the Chief Counsel to the Attorney General and Director of Legislative Affairs, and also Jeremy Perlman, who is an Associate Attorney General and Chief of the Division of Enforcement and Public Protection. Please go ahead and share your thoughts with us.
Thank you for the opportunity to present. Jeremy's going to kick us off. And you're muted, Jeremy.
Still muted, Mr. Perlman. There we go.
Sorry about that. First of all, thank you to the members of the Public Health and Children's Committee for the opportunity to talk about this very important consumer issue. The Attorney General wishes that he could be here himself with you all, but he's in Washington at the White House at an event, and later we'll be talking with his counterparts across the country, and I imagine that this will be a major topic of conversation when he talks with them today. First of all, let me assure you all that this is a critical matter in our office and within the Division of Enforcement and Public Protection. We are very closely monitoring the situation. President Biden, as you may know, did call on state AGs to use their authority to investigate potential price gouging and reports of retailers raising prices and resellers selling formula online at a huge markup. We are working closely with our counterparts in across the country to consider all the legal options to hold sellers accountable. It's important to note that although there are reports of price gouging, we have not received any here in Connecticut. That could change, and we would encourage, if any of your constituents are aware of any information, by all means, reach out to us. We're looking for that type of information because it is of critical importance for us to be able to assure people in Connecticut and the parents in particular, infants, that we're here to protect them from any misconduct relating to this shortage. We've noted that a number of retailers are voluntarily limiting the amount of product a consumer can purchase at one time. This is a good idea, we think. We support that. Scarcity can always sort of lead to price increases and misconduct, potential misconduct with respect to pricing in particular. We are looking very closely to see if there is anything that we could make use of our various consumer protection laws to take action against. At this point, we don't have anything, but we are looking very closely at this and investigating. And of course, price gouging is first and foremost on our mind, because whenever there is scarcity of a product as important as baby formula, the risk increases for price gouging. We are offering folks who reach out to our office advice, and we're doing more publicity about sort of consumer advice that we can offer to warn people about potential scams, make sure people are diligent and are careful when purchasing baby formula, making sure, urging folks to purchase from vendors that they know and trust, established vendors, legitimate vendors, avoiding those that aren't more familiar to them. If somebody suspects that formula could be tampered with or stolen formula, that's another area that we are going to be examining closely. If we get information of that, there's always a potential for that as well when you're dealing with scarcity like this. And of course, we're advising people, there's a lot of sort of information out there, helpful information for parents on where they can find baby formula. They may go to a big box store and not find any on the shelves, but that doesn't mean that there isn't formula available nearby at smaller retailers. So helping them to locate formula, I think, is something that we'd like to help with. Purchasing from well-known distributors and pharmacies rather than from individuals on social media, for instance, that's a good way to avoid being scammed. And then with respect to purchasing from sources outside of the country, unless it's FDA approved, and we did note that the FDA, and Senator Blumenthal noted too, I believe, the FDA has announced sort of an expedited approval process for product that's manufactured outside, and that generally speaking, these are safe products, hoping that will ameliorate the problem. Doctors are recommending against watering down formula. We're aware of that and warning or advising people who reach out to our office to avoid watering it down, or giving toddler formula to infants too. Just generally encouraging people to reach out to our office. Our phone lines are open, our email is open, and people can easily reach us and alert us of any potential misconduct relating to this very important issue. We're very aware of the anxiety and concern that parents have, and we're here to protect them. And that's what we will be doing.
Attorney Perlman, do you mind if you could share with us the telephone number and the email for benefit of people who are listening to this right now?
Sure. Well, Kara, do you have the best number for reaching out?
So our number is 860-808-5318. People can email us at attorney.general@ct.gov. And if you go to our website, which is ct.gov/ag, you can find our complaint form. And the complaint form is probably the best way to submit a complaint. We do encourage consumers to provide as much detail as possible so that we have enough information to follow up.
Okay. And I wanted to also clarify, what about the online sales? What are the controls or jurisdiction for the Attorney General's office for online sales that are being sold in Connecticut? Because there's price gouging in that too.
If we are aware of price gouging that affects a Connecticut consumer, we would ask that they provide us the information and we will investigate. We have consumer protection laws available to us, and we will exercise them to the full extent possible to protect people, regardless of whether it's gouging going on within a store in Connecticut or online.
And another question I wanted to ask you was, do you have a little bit more time? I know you had said that you have another meeting. Would you be able to stay back? Because I want to make sure my colleagues have an opportunity to ask questions as well.
Sure, absolutely.
Okay. With that, I will ask my co-chairs to ask questions. And I also wanted to apologize. The ranking members, we could not have you speak in the beginning because we had a couple of the speakers were going to leave, and I wanted to get them the opportunity to be able to speak. So Representative Steinberg or Representative Linehan, if you have any questions, you get first, and then we'll have our ranking members speak.
Thank you very much, Senator. Hi, I just have a very quick question. So for those who are tuning in today, who are saying, okay, I'm going to the store, there's nothing on the shelves. And when I do find them on the shelves, the price has gone up. That could be for a variety of different reasons. Can you tell us the difference between rising prices and due to, supply chain issues or inflation and what is actually price gouging? How would someone know it's price gouging?
Well, first of all, price gouging itself, a claim for price gouging requires first an emergency declaration from the governor's office. That's not something that has been made at this point. So what we'll be looking at is any potential unfair and deceptive acts or practices in relation to the sale of baby formula, whether that is a deceptive marketing about it or any unfair business practice relating to it. We're going to have to look very specifically at the circumstances surrounding the pricing of it, and that's part of our investigation prior to taking any action. But certainly, we are going to scrutinize that to the extent possible. If an emergency declaration is issued, and that again, as the Senator Blumenthal mentioned, is a function that the governor's office would serve, then any increase of price after the declaration is going to be severely scrutinized and could qualify as price gouging, for which we would enforce our price gouging statute.
Great, thank you. And then just finally, are there any laws that prohibit second-party selling? So if someone goes online and they see on Craigslist or maybe Facebook Marketplace that someone is selling formula. First, are there any laws against that? Number one. And number two, are there any suggestions? And if you don't have any, that's fine. I'll be asking the Grocers Association as well. But are there any suggestions that you would have, to ensure the safety of purchasing these items second market, so to speak?
I can't really speak to it because we're not seeing that. We don't have any information of it. If there was information that somebody was exploiting the crisis, purchasing up formula, selling it at an increased price, if an emergency declaration had been issued at that point, then certainly price gouging statute would come into play. Absent that, we'll be scrutinizing it under our existing consumer protection laws. And again, with a focus on whether any unfair or deceptive business conduct is part of that scheme. But there is no specific law that prevents reselling that I'm aware of that presents reselling.
Thank you. Representative Steinberg?
I don't have any questions at this time. I'd like to give a chance to my colleagues and make sure we can hear from everybody.
With that, Senator Wong and then Senator Summers, thank you so much and for understanding that we had some tightness in the schedule in the beginning. So Senator Wong, you're next.
Thank you, Mr. Chair, and I appreciate you coordinating this meeting. And indeed, happy birthday to Beverly Henry. That being said, I was really glad to hear federal initiative, which obviously the shortage is predicated on the White House and federal action. And I'm encouraged to hear from the Attorney General offices and there is malfeasance or fraud, because obviously it's a very important public health issue. I think it's important for the general public to understand why this is such an important issue, because infant formulas are for infants, babies up to 12 months old in regards to their nutritional supplement. And the shortage of that for a lot of our children and for a lot of our working parents is a public health issue. So for me, I was really appreciative of having physicians here on this panel, and I'm eager to hear from them because I wanted to hear what some of the potential supplements that are acceptable for medical standards that people can seek to supplement and substitute. But also, I understand that we're regularly updating formula substitute information. And so what I like to ask of the committee leadership and or whomever the administrators are, to be able to provide a list of the Attorney General, but also our physicians and the WIC and the formula substitute. I know some of the information is getting out, but I hope that we as a committee can make that readily available for people that have questions. And I am also appreciative, and I'll be done by thanking the grocers, because they're on the front line when people are frustrated and the shortage and the challenge. I'm very eager to hear Mr. Pesci and kind of have him explain what the protocol is, what their anticipation in regards to getting more supplies in to kind of placate the frustration and the anxiety of many of our parents. So again, thank you very much for the opportunity. And I'm eager to hear more about what we can do to get information to the general public. Thank you, Mr. Chair.
Thank you. And I think Senator Summers, she may have dropped out. I saw her earlier. And Senator Kelly, if you're here, you're welcome to. I think Senator Summers may have been just disconnected for a second. With that, I just wanted to make sure that people heard the email and the telephone number. This is something that we are worried about. I have another question for the Attorney General's office. How do we prevent hoarding when we get replenishment of the supplies? The first reaction a parent would want to have is to say, hey, I want to make sure that I'm covered for the next 1 month or 2 months and do not have to worry about this issue. What should we do about that from a policy perspective? I know we cannot make policies right now, but any AG recommendation?
So we're certainly discouraging people from hoarding. I think our view is that it certainly contributes to the problem, and it's understandable. People see the product that they use for their and that becomes available. They want to purchase it, but that is disadvantages all the others. We're not contemplating presently any potential legal action against anybody who is hoarding, although again, we would encourage if somebody is aware of somebody purchasing, an enormous quantity of product for reselling purposes, that would be something that our office would want to investigate. But generally speaking, we're simply encouraging folks to purchase what they need and no more, and are supportive of the retailers who are limiting supply, the number of items that consumers are allowed to purchase.
Okay, thank you so much. Now I'll open it to my colleagues, Kids Committee and Public Health Committee members. If anybody has a question, you may want to raise your hand. We can have you, or your virtual hand too. Okay, seeing none, we thank you so much for your presence and your help and guidance, and you will be hearing from us. I'm sure people, when they have complaints, they will reach out to many of the legislators, and we will reach out to you to share our concerns with you and theirs. So thank you again for your time and being available.
Thank you for having us.
Next, we have, I wanted to get the three speakers to speak one after the other, and then we can take the Q&A from all of them together. We have not one, not two, but three pediatricians today, and it's a blessing to have pediatricians. You are the front line in this situation, and we cannot thank you enough for being there. I wanted to ask Dr. Molly Markowitz to speak, and after that, with the Connecticut chapter of the American Academy of Pediatrics, Dr. Terranova, who happens to be my friend as well, and Dr. Scott Shom as well. So we'll start with Dr. Markowitz.
Good afternoon. Thank you so much for the opportunity to the members of the Committee on Children and Public Health for the opportunity to speak this afternoon. So again, my name is Dr. Molly Markowitz, and I'm a pediatrician who works in New Haven, Connecticut, both for Yale Pediatrics and then also at Fairhaven Community Health Center. And as a primary care pediatrician, I care for both healthy infants as well as infants who have medical issues. And on a daily basis right now, many families are describing having such a hard time finding formula. It's hard to find a specific brand or a type of formula that they usually use. And even in some cases, there's no option. The shelves are completely empty. And this shortage really affects so many of my patients. 75% of infants will utilize formula at some point within the first 6 months of life. And of course, as pediatricians, we advocate for breastfeeding, but however, for many families, formula is the best and safest option. And the decision to utilize formula really depends on so many different factors that both parents and we as physicians consider. It's very personal and individualized. And formula really may be the best option when there are certain medical conditions such as gastrointestinal diseases or allergies or feeding challenges. For example, if an infant has a milk protein allergy or was born prematurely, they may need to use a specialized type of formula that requires a prescription. When a parent is not able to buy a particular type of formula or find it in the pharmacy or store, it's safe to give a different type of formula or generic brand if an infant is healthy and doesn't have any medical issues. However, this is not true necessarily for infants who are on a prescription formula. So this becomes particularly challenging with the limits that we're seeing. I think it's also really important to talk about how parental factors are also make formula use necessary sometimes. So whether it's maternal medical issues or socioeconomic challenges, For example, if a mother needs to work, return to work, or is not able to produce enough milk, formula is a lifeline and safe nutrition where infants get everything that they need. This current shortage is not affecting everyone equally. This is a racial justice issue. Black infants are much more likely to utilize formula and live in households with economic hardship, which again, given the challenges with limited supply, this is so challenging. Some of the families who are looking for formula are able to purchase it online, find supplies, but for example, the WIC, Supplemental Nutrition Program, you can't utilize your benefits to buy formula in that way, which is a barrier. Economically vulnerable families can't necessarily afford the time, gas that's needed to kind of drive around to multiple locations trying to find formula, which is, I'm hearing stories about this over and over again. Families that utilize WIC are sharing that they're currently confused over which types of formula are covered by their benefits. WIC has expanded their coverage to additional brands or types of formula. However, there are formulas that are currently sitting on the shelves which aren't covered by WIC. So it's vital, that families have access to safe supply of formula, as lapses in needed nutrition can lead to lifelong developmental consequences. The American Academy of Pediatrics has issued clear guidance stating that there is no safe alternatives to infant formula. As a pediatrician, with insight into the challenges that families face, it's concerning. We're worried about unsafe alternatives that families may turn to, such as cow's milk, goat milk, almond milk, diluting formula. All of these alternatives can be dangerous and harmful to infants. So as a pediatrician moving forward, I would advocate that our state provide families with accurate information about the dangers, as well as decrease barriers to obtaining it. And I would highlight the American Academy of Pediatrics has put out some great information for families, directed specifically for families, advising them on what to do if they're having a hard time finding formula. And with that, I'd love to answer any questions or concerns that you have. Thank you.
Thank you so much. What we'll do is we'll take our other two pediatricians as well, and then we'll have all the question answers directed towards you guys. Dr. Terranova.
Thank you, Senator Anwar, and thank you, Representative Linehan, for the invitation to join you today. Dr. Markowitz did a wonderful job really providing an outline and overview of what we're seeing on the front lines and why this is such an issue for our families. So I will just be brief and give you a little bit of my background. I've been a pediatrician for 16 years. I'm also in primary care. I practice in Hartford, where I'm the director of a pediatric clinic, and I'm the assistant professor of pediatrics at the University of Connecticut School of Medicine. I'm also here today with my colleague, Dr. Shom, representing the Connecticut chapter of the American Academy of Pediatrics. I'm the president-elect for the chapter, and we have over 600 members here across the state of Connecticut caring for children. I'm really happy to join you today. I look forward to answering the questions that you have for us and really working together to provide information and solutions to families for what is becoming a crisis for many parents right here in Connecticut. So we'll answer questions just after Dr. Shom. Thank you.
Thank you, Dr. Shom. You're next.
Thank you, Senator Anwar, and everyone else who is highlighting this important topic today. One of the questions that I've been trying to answer for myself so that I could help parents across the state is, what is the shortage? How widespread is the shortage? Is it spotty based upon zip code? And I've been having a really hard time trying to find out the answer to these questions. And so I was hoping that someone on the call today has that kind of information who could help guide us, because if it's spotty based upon zip code, there is an opportunity for us to better distribute the formula for parents to be able to get across the state. But if it's widespread, where basically almost all the shelves are empty, then we truly are in crisis mode. And so I'm hoping that there's someone who can help us all on the call today get a better handle on that. Thank you.
Thank you. What we'll do is we'll take the questions that our committee members have for our pediatric experts, doctors. But with respect to the questions that you may have about WIC and so also for retail, can you hold off on those questions because we will have speakers for that specific area. So with that, any questions? Okay, I see Representative Amy Berger-Givallo. Representative Berger-Givallo, welcome.
Thank you so much. Thanks for pulling this together, Senator Anwar. I know that we've spoken at length at the fear that we both have for, and that I know everybody on this call has for not just our constituents, but for parents and babies across the state and the country. So my question is really kind of addressing that fear. I know that we have some very real advice coming at us in terms of substitutions, in terms of what not to do. I am just tapping into the fear that I had as a parent in the middle of the night when I was purely exhausted and had a sick child, never mind a super hungry child, and how my own response as a parent was not as rational as it would have been if I were well rested, if my child was well fed. So I am very concerned about parents in desperation and feeling that absolute helplessness, who really don't have an option to feed their child. So what are we going to tell parents who really don't have that formula in hand to do? Because those are the questions that are going to come to us. Are we going to tell them to ration what formula they have? What if they don't have it? We're not giving you're not making your own formulas. That's not an option. So I am really, really hopeful that at some point, and maybe it doesn't come from this call because maybe that's not information that we're looking for yet, but I'm hopeful that that will be information that we are looking for, because not feeding our state and country's babies is not an option. So if we could just kind of keep that in mind and remember that we don't all behave as rationally as we would if we weren't terrified for our children. So that's really kind of where I'm looking. If anybody has an answer or any sort of comment on that, I would appreciate it. But that is really why I'm sitting here for sure. Thank you.
I think I can definitely speak to the fear that parents experience. So I think they share that all the time, that it's really scary to think about not having an essential nutrient or nutritious food that your baby needs. I mean, that there's nothing scarier than that. I mean, and I think that it's really tough, you know, when it comes down to it. If you have zero formula at home, like hopefully none of our families are going to get to that situation. But the American Academy of Pediatrics has said in like those emergency situations where you literally have zero formula at home and your baby needs hydration, needs, you know, sugar, you can use the toddler formula for a very short period of time, maybe a few days, just in emergency situations. But again, like that, those formulas are not FDA approved. We don't know exactly what's in them. And because it's so important to make sure that we're feeding infants, you know, formula that has the right amount of electrolytes and proteins and sugars and isn't contaminated, that, you know, it would be really important that families only do that in very, very emergent situations.
I appreciate that reminder. Thank you very much, Doctor.
And I would just add that I think we really want to remind families that we're here for you, so call us. If you're in that situation, we want to give you that personal advice for your child, because every child is unique. And what one child might be able to use for a substitute, another child could not. So your pediatrician knows your child and your family best. We're here for you. Please call us, reach out to us. And so that's what we would like you to tell your constituents. If they're calling you, please have them call us. We want to help them.
And actually, as a follow-up on that, for some of our constituents who don't have a regular pediatrician, those who don't have health insurance, who use emergency care services instead of a regular pediatrician who would know the baby or the family, are we advising them to go to an urgent care center and the ER? And what are we doing here?
I would hope that most babies do have a primary care doctor. If they don't, I think that would be a great opportunity for them to call and establish care. We definitely would not turn away any babies that need care. Another short-term venue might be the mom's OB as a bridge, just to talk to another medical provider that could connect them with a pediatrician in the area.
Thank you.
Sure.
Thank you. The next question is from Representative and Dr. Jamie Foster, who actually has her doctorate in nutrition and is an expert in this field as well. So, Representative Foster.
Thanks so much, Dr. Anwar. I am so grateful to the pediatricians for being a part of this conversation today. I would say like 4 months ago, I started getting messages from a shared friend, actually, of Rep. Comey and I, and several other folks who are posting on social media, their children have inborn errors of metabolism. And those specific formulas, those shortages got hit faster than the baby formula shortages. Those sort of came up. And so people with PKU and maple syrup urine disease and homocystinuria, those sorts of conditions that require specific formulas, people were seeing shortages of those right away. And there is absolutely no alternative to those medically tailored formulas for those diseases that are used for beyond infancy. You know, like a child could be 12 with PKU still requiring a specific formula. So I'm curious about sort of supply chain recommendations that you as providers are giving folks. I've spoken to a gastroenterologist about what they're sort of advising people. I'm curious if people are, if your offices and practices are helping connect people with the resources beyond, if you would recommend we turn pediatricians' offices that way, or what additional resources pediatricians' offices could need, and realizing that didn't sound immensely clear. I know that a local pediatrician's office is giving like donated Amazon gift cards to families in need, because if you're on WIC and your specific formula isn't there, you can't order it online, but Amazon might have it. And so they're distributing Amazon gift cards as a stopgap measure. And so I'm curious if that's something you're hearing lots of pediatric offices are doing. And those of us who are fortunate enough to be able to help fill that gap, that's something we could be recommending to other people who are similarly fortunate. Or if there are other sort of workarounds that we should be aware of that help support people with the safe alternatives. Because again, we're not recommending an alternate to formula for any of these families. We're not recommending that people purchase toddler formula in lieu of infant formula unless there is absolutely no other alternative, and that's a struggle. So what is our answer? What are people doing right now to work around that we can bolster as the legislature and as philanthropic members of the community? What are you hearing that people are doing?
Yeah, that's a great point. So I think in general, there are medical conditions that require specific types of formula that it absolutely would not be safe or okay to supplement like a regular type of formula or other alternatives. And I definitely am seeing a hard time where families are describing having a hard time accessing prescription formulas. So we'll send the prescription to either the WIC office or to a local pharmacy, and they're not able to provide that formula, that specific type to them. And so then what's happening is that they're having to call around to multiple pharmacies, trying to locate a pharmacy that has that prescription formula. And that's, a huge burden for both families. And I can only imagine on the side of the pharmacies too, because I know I've talked to many pharmacists who have called around trying to find supplies for families as well. So I think one of the challenges really is that when you have these specialty formulas, like I'm going to give an example, like Elementum is a specialty formula. There are other alternatives. So, that's the Similac brand, but there's the Enfamil Nutramigen brand, which is equivalent, but there's only a few limit options. So there isn't, a bunch of different types that you can access. So that definitely is limiting access for families. In terms of donations and things like that, I haven't personally heard of that or experienced that as of yet, but I think I like that it's good that you brought up about the online purchasing, because I am hearing like families talk about going on Amazon, going on places and finding formula. But, if they use WIC to purchase their formula, they may not be able to buy it that way because they can't afford it. And so that's a barrier to families accessing needed formula. And so it sounds like you guys are going to talk to the WIC team later. But I think, WIC has definitely made expansions in coverage, but I think there's opportunities to further expand to brands that are on the shelves that aren't currently covered, or maybe online ways of purchasing.
And I have one follow-up question. So I know there's sometimes folks worry that they won't have time for an appointment or with a pediatrician, and that they're scrambling and they're stressed trying to find out as things are limited. But I know a lot of your pediatric offices have multiple people who could do this advising, that this wouldn't be something that would be postponed. So pediatric offices might refer, this is sort of asking this question for clarification, to a PA or an APRN or an RD, a dietitian on the office, in addition to the pediatrician. And all those folks working in a pediatric setting could help a parent identify if something they're considering as an alternative is in fact safe or equivalent, and that we're recommending that folks do not crowdsource breast milk without making sure that that's a safe option, or get other sorts of formula, swap out toddler formula without talking to one of those experts in either nutrition or pediatric health to make that decision. That's correct, right? That there's not a family that's going to be put on a long hold, take a long time to go back. If someone's in the grocery store or on the way to the grocery store, they want to know their safe alternatives. Most pediatric offices would have like 1 day turnaround to answer these questions in this pressing time. There's multiple people in the office who can help differentiate between a safe alternative to a formula. Is that correct?
Absolutely. And I will add one other thing as far as resources that pediatricians do have. So nationally, the AAP did provide to pediatricians across the country a phone number that Abbott gave them, the manufacturer that was shut down, regarding super specialized formulas that are really hard for families to find. And the pediatricians can call if they have a patient with a specific medical condition and get a case or two shipped to that family. So we do have that additional resource available to pediatricians. So families should know that they can call us to try and contact that number and get something shipped directly to them for those children that have those inborn errors of metabolism that really can't be sustained on anything else.
Thanks so much.
Hi there. Thank you all so much. Dr. Terranova, I have a question for you. We've been hearing from not only doctors, it's been all over the news. I mentioned it early on in my opening that we have seen a lot of things on social media that talk about homemade infant formula. And in every one of these stories, and in every time that we talk about it, the things that we're saying is it's not safe, don't do it. But when and I think Representative Berger-Javallo really made a great point. Like, it's the middle of the night and your baby's crying and you're terrified as a mom, and you remember the news story that you heard, it's not safe, but no one's ever really telling anyone why it's not safe. So can you just take a real quick moment? I don't want to belabor the point, but these ingredients, I Googled formula shortage replacement recipe. And I got this from a blog from a mom who specifically says she's not a doctor, but she, likes to talk about meals on $6 a day, and put out this meme that gives this recipe. And the recipe says evaporated milk, water, granulated sugar, or light corn syrup, along with infant vitamin D drops, DHA drops, and nutritional yeast. It sounds like, oh, they really thought of everything, right? They thought of a way to make it look like formula. It has the vitamins that they need. Can you explain actually why something like that is dangerous and what could possibly happen to your infant? And then, if out of desperation you did do that, what should you look for to know that something bad and dangerous is happening?
Thank you for that question. So there's a few different concerns that we have, and I would say probably one of the underlying ones is a risk for contamination when you're making something at home. So we just had this factory shut down that's supposed to be sterile and doing everything right, and they had a contamination issue. So you can imagine in your home kitchen, it's probably not the most sterile environment. So that's kind of a basic concern that we have with a homemade formula. And then with the ingredients there, formula has been changed, tested, developed over many years to be as close to breast milk as possible, because we know that human milk is what's best for human babies, but that doesn't work for everybody. And so we have formula as a substitute. And so we need to have the exact right balance of protein, carbohydrates, fats, different vitamins, nutrients to promote optimal development for babies. So some of those ingredients might not have the correct ratio or amounts, particularly things like the salts and the sugars, which can cause harmful situations, including things like seizures for babies if they are really out of balance. We're really also worried about kind of more long-term effects. You know, a one-time giving it isn't going to cause anemia or inhibit brain development, but more prolonged use would, if there's not enough fat, if there's not enough iron. Some people sometimes try and use other types of milk, other animal milk like goat milk, which is not recommended because of a concern for a different type of anemia that can develop, or plant-based milks, which don't have really enough fat that's needed for brain development. So there's a lot of different reasons that homemade formula is not going to be best for your baby. And so we really want people to not try and experiment at home and to call us for something that we can provide that would be most beneficial for your baby.
Yeah, thank you so much for that, because, you know, every time I see someone discussing these homemade formulas, there's inevitably someone says that's how we did it in the 60s. And, you know, I think now that we're looking at 2022, we have the benefit of greater knowledge. So thank you for that. And I've been a breastfeeding advocate for years, and we've said a couple times on here that breast milk is best, but we also recognize that some people just can't nurse, whether it be that they, you know, their physiology says that they can't nurse, or maybe they're even foster parents or adoptive parents. There's a million reasons why you could possibly not have breast milk, but Connecticut just had their first outpatient donor milk bank. And that is in Glastonbury. And then there's also I believe it's the Milk Bank of, I want to say New England, but it's something that if you just Google breast milk banks near me, you will have a list of ones that you can find. So I know that the idea of somebody else's breast milk might feel a little odd to some parents. And I will go to Dr. Terranova, but if there's any other doctor on the panel who would be able to answer this, can you guys give some information to a mom who's watching this, who has formula fed her child and now can't get their formula, and you want to have them relax a little and be open to the idea of breast milk? Can you explain to those parents how a donor bank works and the safety behind that?
Sure. So you could think a little bit of a donor bank almost like a blood bank, in the sense that it's really medicalized. The breast milk is screened for any diseases that parents might be worried about that would spread through breast milk, and is ensured to be safe for the infant. So parents don't have to worry that they are getting breast milk from someone that may be on different medications or have an underlying issue that could be harmful to their baby. So just like donor blood is screened, tested, and made sure that it's safe, the same thing is true for donor breast milk. So parents can rest assured we use it in the NICUs for the teeniest, preemie little babies, where it's safe for them to take it. And so parents of older children can be reassured that it is safe as well.
Yeah, and so Dr. Foster and I just had a little sidebar, and we're talking about how there have been some people saying, I have extra breast milk if anyone needs it. There's a difference between your neighbor providing breast milk and a donor bank providing breast milk. So if we could just reiterate that it's always safest to go through a donor bank, but it really just made sense to me. I will say that my youngest is 9, and I'll be honest with you, I still have some breast milk in the back of my freezer. I would never donate that, right? I'm going to make a ring out of it. It's a thing. But I wanted to just say this because there are people who have freezers overflowing. So if to the mothers out there who are thinking to themselves, I actually have breast milk, I may be able to donate. You know, do you have any information on, and I'm sorry, I'm putting you on the spot, how old that milk could be that you've recently pumped and stored, and where would you suggest, or how would you suggest donating that milk to a bank?
So they can just call the milk bank directly and let them know what they have and how long it's been stored and how it's been stored. So a deep freezer would provide longer storage, not 9 years, sorry, usually a few months, up to 6 months, maybe the most. In a regular home freezer, a shorter term, couple of months. And if it's been in the fridge, then it's not going to be able to be used probably unless you just pumped it today and are donating it today. But definitely just reach out to the donor bank and they can provide you advice on how to get it to them, because I think they are really being overwhelmed too with people trying to access all sources of milk. And so they'll be open to donations.
Great, thank you. And Senator, those are my questions. Thank you, sir.
Thank you. Anyone else have any questions from our members? Okay. I think I'm just going to ask another question. I see Representative McCarty has a question. Representative McCarty, welcome.
Yeah, thank you very much, Senator Anwar. And again, thank you for the presentations today. And if I may just circle back for a moment, I know Dr. Schultz asked the question originally. I think we need to really try to identify what the extent of the emergency is, the widespread, and put our thinking together to find a comprehensive way to receive those questions from people that may be experiencing the shortage. I also, just to comment on Representative Linehan, I think there are probably many mothers that are doing both, breastfeeding and using formula. So I would think we would want to try to encourage those mothers to actually save some of the breast milk. So in case they have a shortage and they have the need. But I think I'm just having a little trouble trying to figure out just what exactly is the extent. What are we doing to really pinpoint that? I understand WIC and the milk banks that individuals can call, but I don't know if anyone on the call has any ideas about that, but it's just something I think we need to know, the absolute, what is the widespread condition right now. Anyone?
I can say that, as doctors, we do love data, but unfortunately, I don't have that info. But what I can say is I think pretty much every patient that I see who's on formula, the parents describe challenges accessing enough formula. No one right now is saying, oh, no issues, formula's fine, everything's great. I think every family shares that they're struggling. And there's various degrees to, oh my gosh, I'm so worried we barely have any formula at home. I don't know, in a couple of days where we're going to get our next, supply to, people just kind of more worrying long-term in the next couple of weeks, that kind of thing. So there's a variety of severity, I should say.
And thank you for that response. And I think it was somewhat encouraging earlier to hear from Senator Blumenthal that, on the federal side, looking out to see where we can get the imports and to try to really address the issues. So I appreciate those comments. Thank you.
Representative McCarty, I just wanted to respond to one of your statements. Yale New Haven Hospital has been kind enough to put together some do's and don'ts for parents when it comes to the shortage. We will be providing that with to every member of the committee who would want to share that with their constituents. The best thing that we can do as the Children's Committee and Public Health Committees is really to help educate parents on how to get through this. So that will be in everybody's inbox before the end of the day today. So thank you for that, Rep. McCarty.
Thank you very much, Representative Linehan. I did see it, but thank you for reminding us, and I will receive it again. Thank you.
Thank you. So I have a few questions. I'm just going to quickly ask our pediatricians. One of the questions that I think on some of these sites was asked was, can we use formulas that are expired, and how long would they be potentially useful for? Any thoughts on that? And I know officially the answer is no, but in a situation like where we are right now, what could be reasonable and safe?
That's a hard question. So I have not seen any official guidance from FDA as far as safe use beyond the expiration date. So I don't really feel comfortable providing that as advice right now to families. Certainly it's something we can look into and see if they're saying it's 1 week, 2 weeks, 3 weeks past the expiration date, it might still be safe. But for right now, if families are able to find something that's not expired, that would be definitely recommended.
Any other pediatricians want to weigh in?
I agree. I think the AAP right now, recommends not using expired formula. So I think more information would need to be gathered. And I think we do worry about things like contamination or, breakdown of essential nutrients that could be harmful with expired formula. So I think it would need to be a thoughtful decision on whether or not it's safe or not.
And is there, the other question I wanted to run by you was, is there a reliable site which would be able to compare formulas from different companies, which would be for the regular formulas, but for specialty formulas? Is there a place which would be able to say, use this company's XYZ formula with the other one and they are comparable? Is there a reliable source for that?
Yeah, so I think so there isn't like a comprehensive source that I know of, but one place that's helpful for families who are utilizing WIC is on the Connecticut State WIC page. There's currently a document that shows the equivalent. So if, for instance, you were approved to have Similac Advanced as your previous formula type, then the equivalents are listed next to it. So that would be, parents could use that as a guide of knowing what's equivalent. I will say, every baby is different and there are subtle differences, but if you have a normal, healthy baby and, you check in with your pediatrician and they say it's okay that they use different types of formula, that generally different brands are equivalent. Generally different types within a single brand are equivalent, whether it's a sensitive or a spit up, generally those types of formulas are safe to use. Their families report subtle differences. But again, I think it's always important to check in with your pediatrician first, and then, can utilize like generic brands, for instance, that might be more readily available.
Thank you so much. Thank you for that. And then seeing no other questions, I will ask our next speakers to come in. But before we have the next speakers come in, I wanted to read into the record a testimony from Congressman John Larson. He had reached out to us. We wanted him to come and speak, but right now as we speak, he is in the midst of a Social Security related meeting in Washington, D.C. So he sent the following message. I wanted to go through that. Thank you for the opportunity to address this body. I know that many of our constituents are facing severe distress over the current shortage of infant and specialty formula. This issue calls for nothing less than urgent and comprehensive action, and that is what Congress and the Biden administration is doing. Yesterday, under the Biden administration, the Food and Drug Administration reached an agreement to resume the production at the Abbott Sturgis facility in the next 2 weeks, pending court approval. This is a progress, but will take upwards of a month to have any effect on the availability of formulas for families. Last week, the FDA announced actions to immediately improve the US supply of infant formula, like allowing flexibility in the movement of already permitted products from abroad, streamlining imports with favorable record, and asking retailers to continue purchase limits to protect infant formula inventory. The administration has also taken action to prevent scarcity pricing and price gouging. Abbott and other formula suppliers have also increased production at other FDA-registered facilities and have already been able to increase product distribution. For families who are dependent upon specialty formula for children with life-threatening illness, the FDA will continue to work with Abbott to allow for the immediate release of metabolic formulas on a case-by-case basis. These parents already shoulder a great burden and should not have to fear for their child's life due to lax government oversight. Additionally, the Biden administration has urged states to exercise their waiver flexibilities. I am grateful that thanks to the leadership of Governor Lamont and Department of Public Health Commissioner Jutani, Connecticut took swift action to request and receive maximum flexibility for the state's supplemental nutritional program for women, infant, and children, the WIC program. Thanks to their continued efforts, the impact on how many low-income families has been as reduced as possible. This morning, I led a letter to President Biden signed by nearly 150 members of Congress urging his administration to continue these whole-of-government efforts to include infant and child formula in their broader supply chain resiliency plan. It assures that the president that we stand ready to provide whatever resources are needed to deliver for families and get products back on the shelves. This week, the House of Representatives will vote on a bill drafted by Connecticut's own Representative Rosa DeLauro, chair of our Committee on Appropriations. This bill will ensure the FDA has resources needed to continue these efforts and take action to prevent this problem from happening again. We will also vote on legislation to ensure the federal government is providing maximum support for our state's WIC programs. We know there's no overnight solution, but we are working with every lever we have to increase supply as fast as possible, while also making sure that the product is safe and reliable for the infants and children and who rely on it. We can and must stop this shortage from ever happening again. Sincerely, John B. Larson, Member of Congress. Thank you so much, Congressman Larson, for your efforts. And with that, I wanted to ask Marcia Pesolano, Director of Women, Infant, and Children Program, along with Miriam Miller, Special Projects and Policy Manager. Welcome, and thank you for being with us today.
Thank you so much for having me here today. Again, my name is Marcia Pesolano. I'm the Connecticut State WIC Director here at the Department of Public Health, and I'd be happy to share with you what WIC is doing in Connecticut to help our families manage the shortages that have occurred. As you know, or as you heard earlier, WIC state agencies are required by law to have competitively bid infant formula rebate contracts. We agree to provide one brand of infant formula, and in return, the manufacturer gives us a rebate for each can of infant formula that's purchased by WIC participants. In Connecticut, we are currently part of a multi-state contract with Abbott. We also, as you also heard earlier, infant formula shortages have been an issue since last fall across the US due to supply chain issues, which resulted from the COVID-19 pandemic. But these shortages were exacerbated in February when Abbott recalled various lots of powdered infant formula manufactured in their Michigan plant. This unfortunately is impacting all families, not just WIC families, but we are also feeling those impacts. The WIC program quickly sprang into action in February when we were alerted to the recall, and we requested and received approval for 3 waivers as recommended by the USDA that allow us to apply maximum flexibilities in response to the recall and help to make sure our families have access to the formula that's available in stores. These waivers remain in place today and will continue through September 30th. During this time, we have not been enforcing the minimum stocking requirements that are usually required of our authorized vendors for infant formula because we know how challenging it can be for our vendors. We are also communicating regularly with our families to provide support and information on available options, including the temporarily expanded WIC formula list, which is available on our website. We know that families are struggling to find formula in stores, and so we are also providing information through our WIC Shopper app, which many of our families use, and we are also providing information through text and through our local agency partners. For families that use special formula, we are working with those families to ensure that they can communicate with their healthcare provider to discuss appropriate options when a formula is unavailable. When needed, we've been working with the manufacturers to ship emergency or courtesy supplies to those families. We make sure that we keep our website up to date, both for families and for retailers, and we are using our social media channels as well. Although breastfeeding is not the solution for everyone and is not the solution to this problem, we recognize that some families are breastfeeding and supplementing with formula and are helping them to increase breastfeeding if they are able. Up until recently, many of the things that we have in place have been able to help families find what they need, but we know that have made it difficult for our families. So the one thing that we want to make sure families are aware of is that WIC is here to help them. If they are having trouble, they should contact their local agency to see if they can be assisted in finding an alternate product, or if they need to speak with their healthcare provider to find out what kind of product they need. They might be able to check smaller stores or pharmacies for availability and to ask those vendors when they can receive new stock. We are also encouraging families to buy formula online if they can, purchasing from well-recognized distributors and pharmacies. We want to make sure that we echo the statements that were provided earlier about purchasing from reputable places. We want to ensure that people know that it is unsafe to dilute formula, unsafe to make homemade infant formula, and use cow's milk or other milk substitutes to feed infants as described earlier. For WIC families that need additional assistance, they can reach out to the state agency, and there's some information on our website about how to contact us at 1-800-741-2142 or using our email box ctwic@ct.gov. I also wanted to talk a little bit about online purchasing because I know that was discussed earlier. Currently, WIC is unable to do online purchasing for a variety of reasons. Federal regulations prevent us from people purchasing without having a physical presence. So they are required to purchase in front of a cashier. In addition, we have not been able to find stores that are interested in online purchasing at this time. There are some pilots going on across the country to determine how best to navigate WIC benefits using online purchasing. And so we look forward to learning more about that when that information is available. And I'm happy to take any additional questions about the information provided.
Thank you, Marcia.
so much.
And I'm just going to add from a DPH perspective, we're tracking the issue along with our sister state agencies like OEC, DCF, DSS, DCP. We're getting information from the federal government with regard to updates on availability of formula and whatnot. There's not much in our control of what we can do to change the situation outside of what Marcia described, but we are tracking it closely. So, you know, in Representative Larson's testimony, he mentioned that the facility is going to be opened soon, and that's the result of the federal government reaching an agreement with Abbott on next steps that they have to take in order to open the facility. And so that includes, you know, hiring a sanitation consultant, testing their products and notifying the FDA of contamination, implementing detailed sanitation plans, environmental monitoring plans, and new employee trainings. So the federal government has implemented a lot of additional oversight measures on Abbott to ensure safe future production. They're also, you know, it's also worth noting that 50% of states and territories that have WIC contract, or 50% of the contracts held by WIC state and territories are held with Abbott. So, you know, there are states that don't have maybe this specific problem with WIC, but Connecticut specifically is strained by this. Other folks like Gerber and Reckitt have increased their supply and production. So Gerber has increased their production by 50%. Reckitt has increased their production by 30%. So, and then, you know, on a call with the feds this morning, they implied that, you know, we're going to be seeing more formula on the shelves in the next couple of weeks. But part of the challenge too is the panic buying. So as the panic buying slows down, additionally, we'll be able to see more relief on the shelves. And then I'll also say that Abbott has a website, abbottnutrition.com/store locator, which folks can use to find stores that may have formula in stock. And I can put that link in the chat as well. They did have a hotline, but somebody recently tested it. And so it didn't quite produce the results we were hoping for. So we're going to look into that more. But DPH, we sent a list of resources to legislators on Friday. As information changes, we're going to be sure to update that. But if you haven't had a chance to read through the documents and information we sent around, I would recommend doing that. It has a lot of great talking points and information that Marcia put together. So I think that's going to be a really helpful resource to you as you all work directly with your constituents.
Thank you so much. I see Representative Amy Berger-Givallo has a question or a comment.
Thank you again. I appreciate it. And Miriam, thank you specifically for the back and forth last week. I appreciate that you were so available and quick to respond as I was asking questions related to that document that you sent out to us. Related to that, it was discussed more on Friday about how non-WIC families can reach out for help. Now, obviously, we've gone back and reaching out to pediatricians or to, even if not your own pediatrician, reaching out to some kind of pediatrician is the first step in trying to find formula if you cannot. However, if they're running into dead ends there and assuming that non-WIC families can still reach out, do they use the same contact numbers that were just provided and that were provided in the email last week? Or is there some sort of gatekeeper system that only allows WIC families with, whatever numbers they have to get through?
So no. So I have spoken with several members of the public that are not WIC families and provided them some information, which is also now available on our website. There is a document from the Health and Human Services that includes some additional store locator information that I'll be sure to share. I think that's helpful for families so they can go online and try to see where they might be able to find formula. So we're also just trying to make sure that non-WIC families have that information in their hands as well.
Wonderful. Thank you so much.
Thank you. And I see Representative Foster has a question too.
I want to start with a quick thank you to Miriam and Marcia. In February, I was meeting with them about something totally unrelated, and that morning had received an email from a foster family in my district who was having a hard time acquiring specific formulas and was very promptly brought to solutions and help, which brings me to my question for everyone. We know that there are lots of families in Connecticut who are eligible for WIC and not getting the service. Can you just take a minute to talk about how easy and important it would be for a family who's eligible to get into WIC now? Because we're hearing about all of these challenges and issues, but WIC as an agency is really helping people access. They're getting access to nutrition counseling in addition to the additional food services that they're getting. And if a family is considering transitioning to solid food at an earlier time point, all of that stuff can be discussed with a nutritional professional who's trained and skilled in those regular appointments, in addition to them getting additional financial resources for participating in the program. In general, as a scientist, I just think WIC is the most evidence-based nutrition program that exists out there, and it's an unsung program, and there's no reason for us to see decline in participation from a science standpoint. More and more people should get into WIC if they can. So who is eligible for WIC? Not just women. Can we comprehensively talk about who might be able to enroll in WIC now and get help in procuring formula if that's what they're doing with their family? And why is now a good time?
And I would love to talk about the benefits of WIC and who's eligible. We always want everyone who's eligible to talk to us about if they can join and participate in the program. So just to clarify on eligibility, we are able to work with women who are pregnant and postpartum, as well as infants and children up to the age of 5. In addition to categorical eligibility, which I just described, they also have an income requirement. So anybody who's currently on SNAP or Husky or receiving TANF, so the Temporary Assistance Program through DSS, is what we call adjunctively eligible, which means that they're automatically eligible for WIC, but there's also some income requirements that they would need to show us so that they can participate if they're not currently enrolled in one of those other programs. They also have to have a nutritional risk factor, and so that's where they have to speak with one of the members of our staff and come in for an appointment to determine their nutritional eligibility.
And just one follow-up question, because I think sometimes people are assume that they're ineligible. When the program is called Women, Infants, and Children, it's because it's for women who are pregnant or breastfeeding, but it is all, you are also eligible if you are the dad or grandparent primarily responsible for the child. If you have custody of that child, you are allowed to enroll in WIC on that child's behalf from birth to 5, correct?
Yes, thank you, Representative Foster, for clarifying that. Yes, caregivers as well are eligible to sign up for the children that they care for, like you mentioned. And for families that are interested in applying or interested for more information, we do like to direct them to our website. There is a link on our website where they can apply, which I can also add to the fact sheet that we recently distributed, so everyone's aware. It links to an online application that people can go into and apply, or they can contact us on the 800 number that I mentioned before, or through our Connecticut WIC mailbox that I also mentioned, to find out if they're eligible. We can get them connected to a local agency in their area.
I just want to reiterate for a second, because I think WIC is really an opportunity for food security. What we're talking about here with a formula shortage is an issue of food security. But as we enter the summer months where farmers markets are open, the benefit of enrolling in WIC significantly becomes more robustly impactful, because those families have increased access to resources at local farmers markets too. So I just want to reiterate and make sure like this is clear on the record. Any family who might be eligible for WIC, please check. Enroll if you can, and you're getting access to a nutrition professional who can help you navigate this issue of formula, but they can also help you navigate every other nutritional hurdle that you have with your child moving forward. So it's a really underappreciated, I think, resource for families that could be really helpful right now. And we know that people are flooding pediatricians' offices right now looking for help in, is this safe? Can I do this alternative? Your dietitian or nutrition professional that you talk to at WIC can answer those questions for you also. And they are a skilled nutrition professional trained in helping you make the determination of what's best and most healthy to feed your child. So I recommend wholeheartedly and enthusiastically that anyone who can enroll in WIC who's not, do that now so you can get access to that resource and get that help. But thanks so much, Marcia and Miriam. You guys are great.
Sure. I'd also just want to mention that in addition to providing the food resources and the support, we also conduct referrals. We help families connect to their provider when they have questions. We also provide breastfeeding support and education. So I just wanted to take the opportunity to mention those additional services that we provide. And I would mirror Representative Foster's comments about making sure that if you are potentially eligible for WIC, that you check, because we would welcome enrolling you.
Thank you again. Can I ask a quick question? With respect to this online sales issue, how soon do you think we'd be able to get some direction?
So again, there's a regulatory requirement to have folks purchase in the store. They have to purchase their WIC items in the presence of a cashier. So that is something that I know is being looked at nationally to determine if those regulatory changes are needed, especially in light of the COVID pandemic. We know that a lot of people want to be able to purchase online. So we're working with our National WIC Association to discuss and educate folks nationally about what's needed in order to make that easier. So it's a matter of when something like that happens, if that does come from the federal government.
So we've sort of a perfect storm brewing from that perspective. If a parent has to drive across the different parts of the state and the gas prices are very high despite the gas tax break that we have provided as a state, it's going to add a lot of burden to the families. And they're driving 30 minutes, 40 minutes, 60 minutes in some situations. If we can come up with a solution so that online sale is allowable, that's going to really help improve some of the challenges that people are facing. So I just wanted to see if there was a way to expedite that and if something can be done about that.
Yeah, and Senator Anwar, I'll just add that I think that's a really great question for Senator Blumenthal. A lot of what we can do and where we can innovate is regulated by the federal government and stipulated by them. So, unfortunately, the online purchasing can't necessarily be a Connecticut-specific solution or initiative. We can be supportive of it to the extent that we can be in the groups that Marcia had mentioned. But as far as who can actually make that change and have, a broader effect on that, it's going to have to happen at the federal level.
Thank you for that.
We're supportive of it.
Thank you. Thank you for that. Any other questions? Seeing none, we will move on to our next speaker. And then please stick around for a little bit, everybody else who's spoken earlier, if you can. The next person is representative of the Connecticut Food Association, Wayne Pesci, president of the Connecticut Food Association. Welcome, and thank you for your patience with us today.
Good afternoon, Senator and Representative Linehan. Please, thank you for inviting me to join the group today. I've been listening for the entire conversation, and a lot of people spoke about a lot of things that are happening around this issue. It all does stem back from original supply chain issues prior to the Abbott recall and the shutdown of that facility. There were some supply chain issues that have been exacerbated by that. One of the representatives earlier had asked where we were. The supply chain's at about 40%. So for every 10 cases of formula that a retailer orders, they're getting 4. And on top of that, what happened initially when the recall came out, there was a lot of panic buying, and people were still panic buying up until about 2 months ago when most of the retailers in the state imposed limits. So right now there are limits, in all of the retailers in the state are imposing limits on formula buys. So that's helped, but initially it was a very difficult situation, and continues to be today. But there's been some news in the last 48 hours. Senator Blumenthal mentioned it. Representative Larson mentioned it. Some leadership by some Connecticut representatives have loosened up some of the regulation to get the plant back online. That's not going to help for another 8 weeks. And I just saw, and I will share this information with the committee, Nestle's announced that they are shipping formula over the next 7 days into the U.S. from Europe. So we're going to be getting a bunch more imports that'll help us until the supply chain comes back online. One other thought, the Attorney General mentioned price gouging. I was just pleased to hear that they had not had any complaints in the state of Connecticut. Our retailers are acutely aware of what is happening and what this is doing to families. It's just not formula, it's food prices in general. So I was pleased to hear that there had not been a complaint in the state of Connecticut about price gouging. But I'm getting a lot of information federally. I will get the emails for all the members of the committee and share all of the information that I'm getting pretty much on a daily and weekly basis, just to keep people informed, because the supply chain's broken right now. And there's a lot of people working to get this thing back up to speed. And I don't anticipate this getting cleared up until at least the fall. We're gonna have a difficult summer.
Mr. Pesci, thank you so much for being here. Thank you for coming and talking to us. But exactly what you're saying, the supply chain, it's an issue, not just nationwide, but worldwide. And this brings me back to the same thing that I am always saying as co-chair of the Children's Committee. Let's figure out what we can do to help families now. So one of the questions that I have for you is about, when you go to retailers in our communities, they're really partners in many aspects. And the people who work at your grocery store and sometimes even at your bigger box stores. And so what are ways that consumers can utilize relationships with their stores to know, what are the questions they should be asking? Like, when do you stock your shelves? what days are your deliveries? So if they have a specific formula, is it okay to ask them if they could keep a list of people to contact if a specific formula comes in? What are retailers looking to do to be able to help kind of on that one-on-one basis?
Well, the first thing I heard that earlier today about what do I do? I'm driving around. I personally would call the store. I think that's before you take a ride and it wasn't there, you can always call the store. Someone is going to go check, and then you can always go to the courtesy counter and say, look, this is the type of formula I need. Can you please give us a call when this comes in? And they will give you a call. You talk about those relationships, they're critical, but I think that, consumers can do some things prior to going out to the store to see if it's there. And then if they go to the store, they can leave their name and phone number at the courtesy booth or with, somebody up at that front end, and the stores will get back to them, especially on infant formula. I mean, this is really critical stuff, and we're acutely aware of it. I mean, we've been talking about this issue for months internally, knowing that it's a problem. We've had to move some of the product away from and off the shelf because, like the Tide Bandits, we now have formula bandits. So there's people out there that are taking advantage of the situation. We're aware of that, and we want to make sure that people, specifically mothers with small children who need formula, can get it if we have it. So I would recommend that they leave their name at the courtesy counter and say, look, when this comes in, can you please call me? They'll get a call, or they call the store before they go to see if we have it.
Yeah, I think that's really important because sometimes we hear from people that they don't feel comfortable asking others to do this work for them, right? But what I'm hearing from you, Wayne, is that this is something that you guys have been talking about as retailers, and that you recognize that this is one of the actionable things that you can do to help people, and that these stores are ready for these questions, correct?
Correct. We're well aware of the situation. The other thing I would tell you is that I spoke to 3 very large chain retailers today, and they've all committed not to raise their prices throughout 2022 on the formula products.
That's fantastic and extremely helpful.
Yep.
I'm wondering, is there any industry-wide, at least here in the state, effort to coordinate inventory, to know whether it be just within certain stores in a chain or throughout the entire state and all different stores, who has what and when?
That's been very difficult because they'll order from the manufacturer, and 40% of that order will come in. So that's where it gets very difficult, because they're not getting the supply that they're ordering from the manufacturers. And I think it was Marcia from Wick who had mentioned we have a large supply of Abbott products in our stores, and they're I don't want to call anybody out, but that's the biggest culprit at this point, and it's really making the situation for the retailers here in the state a little bit more difficult because of how big they are in our state.
Yeah, you're trying to be nice and you don't want to call anybody out. I have no problem doing that. Right. So Abbott, in their slight defense, it was a voluntary recall. But if everyone's doing everything right, there shouldn't have been that recall in the first place. And then, of course, A, B, C, D, E, all the way down to Z, items have caused more and more problems. So while everyone's trying to fix that, I think that a big part of how we fix it on the ground for our parents, until such time that our federal delegation can work to change the whole system and get that up and running again, it's really going to come down to what's happening at the store level, what's happening with the parents, what's happening talking to your neighbors. So, with that, when I go to a store and I want something and they don't have it in my size, there are certain stores that can look up if they carry that at a different location. Is that the kind of thing that is available in grocery stores and big box stores here in Connecticut?
Yeah, I mean, yeah, if you get somebody who's stocking the shelves over there in that area, or even a grocery manager or somebody like that, they've got a pretty good handle on, what their inventory levels are, when their orders are coming. It's fair to ask those questions, and leave a phone number to say, listen, can you call me when this comes? Because this is not, champagne or some high end item. These are people who are trying to feed their families. And the people in the stores get that. So they're under as much pressure to try and help solve it when they don't have the resources to do it. I would just say that from my perspective, having been on this issue since probably late last fall when the supply chain was started to be a real problem, is that we're actually just now right at the other side of this with some of the changes that have been made in the last 72 hours around loosening up regulations, forcing plants to open back up and allowing imports. We should see this, 40% in the next 5 or 6 weeks get to 60%, which is a big difference. There's a big difference when you get from 40 to 60. It's still a problem, but it's getting better. So I think we're at the bottom of this right now. And I think some of the steps that have been taken in the last 72 hours are going to start to increase the supply, and people will see that on the shelves. It's got to play itself out. And we've got to get those boats over from Europe, and we've got to get, plants back open and the shelf stock back up.
Thank you. And then my one last question, Wayne, is actually, can you take a minute and just speak directly to parents and caregivers and let them know, just kind of itemized list of what they can do in partnering with their local grocery store in order to help? Sure. So what information can they ask? How often should they call? Just kind of for, if you can, a quick list of a cheat sheet of what parents can do.
Yeah, I think the first thing that they can do is they can call the store before they come if they don't want to run around, right? And it helps because you can make 3 or 4, there's probably 3 or 4 retailers in your area. You go to your first one where you're pretty loyal to them and say, hey, I'm coming to the store today. Do you have formula in stock? And at that point, they would probably most of them will probably hold it aside for you if you tell them that you're coming. Or the other thing you can do is you can, leave some information with them as to, okay, you don't have it today, but you guys are probably getting something tomorrow or the day after. Can you please turn around and give me a call and let me know when this is in? And they'll get a call. So I would recommend just, finding that front end person, that person that's in the front end of the store. There's, each of the retailers has kind of a different setup as to how they operate on the front end, but those people can be extremely helpful. A lot of the stores have customer courtesy booths. I would start there and just, hey, I'm here all the time. Here's my name and number. I have a baby at home and I need formula, and I would really appreciate if you could give me a call when it comes in if they didn't have it on that day. I think that's the best way to go about it. And what I can do from my end too is I'll certainly send something out to a larger group, to the whole landscape, and say, look, obviously consumers are looking for information, and do we have any best practices that any retailers are doing, and share those among the group too. And I would certainly share that with this committee when I dig in on it, because there are some best practices out there.
Yeah, I appreciate that so much. And, we've been speaking now for a couple of days. And so I appreciate you doing that because, as I've said time and time again, the single number one best thing that we can do as representatives is to get the information out that tells parents how to do it for themselves. So I appreciate you. Thank you very much. And with that, I will send it back to Senator Anwar.
Thank you, Madam Co-Chair. Wayne, I wanted to just say that, a crisis brings about the worst in people, but also the best in people. And
right.
What I heard what you and your group is doing is very exciting and the best. So I wanted to thank you for that. I just want to go a little deeper into one of the questions that Representative Linehan had asked. There are a group of children who are much more vulnerable than the others. These are the ones with metabolic disorders whose life and well-being depends on the exact formula that they are supposed to have by prescription. And so there's a general response, but there's a very focused response. Thankfully, that population is not very large, but it's the meaningfulness of having the right formula for them is very critical. It's life-saving. Is there a way that your network can create a mechanism of that availability and connecting them with the specific families in collaboration with the American Academy of Pediatrics in collaboration so that we can actually address those children who are arguably the first in line right now?
Well, I will say one thing that I think that the limits when we do have the product are going to help. So if some person comes in who has the means to buy it all, let's say they're not allowed to do that currently, right? So that's rather new. That's just in the last 2 months where the limits have been really enforced. So I think that's helping along those lines. But anything that we can do or anything that I can do personally to lean in and help create that because it doesn't exist, we're certainly willing to lean in on, Senator.
Okay. And are there internal checks on price gouging within your organization?
No, not necessarily. No, there are not. Only because we don't really kind of monitor pricing for the stores. But I can tell you that based on the conversations I've had just in the last, 2 weeks around, supply chain issues and pricing and things of those natures, I was just telling Representative Linehan that, there was a commitment from 3 of the largest retailers in the state, grocery retailers, that they weren't going to raise their prices through 2022. So they are aware of the fact that, who this is impacting and how it impacts families. So, I can't answer that specifically, but I can tell you I was very happy to hear from the AG that there wasn't an instance in Connecticut, and that our CFA members and Connecticut retailers are doing the right thing for consumers here. So.
Thank you. I think there's an opportunity on the coordination end that I think maybe your organization could start to look if there's a collaboration coordination across the different retailers where some of these short supplied life-saving formulas can be coordinated in a manner where it reaches exactly where it needs to get to. That's going to be an area of opportunity depending on the timeline of response from the federal government and solutions that we are anticipating. So,
I will, coming off this call, I'll circle back with your office on Thursday just to get some ideas of how to get started on that, and certainly willing to take that on. I mean, it's an important issue. So, anything we can do to help communicate better with folks and give them information is a good thing. So.
And to our pediatricians, I did have a conversation with the executive director for the American Academy of Pediatrics to see if there was a way to identify and have a better understanding of where the exact needs are and have a map of that available so we can actually take care of the most vulnerable of the children in our state. That's going to be very critical. To give you an example, in every town, there is a mechanism that who are the people who are on life-saving medicines or life-saving machines or on oxygen in the situation of a disaster. The towns have kept a map of who are the people when there's going to be prolonged shutdown of electricity. There would be a mechanism to protect those individuals. In the same way, we have not done something like this for our children who have specific needs, and we have not mapped that, whether it's a town-based mechanism or a state-based mechanism or the American Academy of Pediatric-based mechanism. So that's a weakness that we should try to figure out a way of solution around, and then we can actually match the minimum supplies that are available so that they are given to the ones in a timely fashion who need it the most. I think we have opportunity to fix this internally within our state.
If we know where it is, we can probably redirect product to those areas and categorize it in a sense that we know that there are, we need more product in I'll just use Bridgeport for a second. And we know we need to keep those stores, with a heavier supply when we have product and allocate it that way. We certainly have the, sophistication to do that if we know where it is. So.
And another question is, do you have an understanding of the timeline of the supply? In other words, is it predictable that, well, we're going to get X amount of supply in the next week or 2 weeks time? Do we have information and mechanisms for that?
I can ask that question to several of the larger retailers, but what I've been led to believe is that when they order 10 cases, they get 4, and then they allocate it evenly across their stores.
Okay. Good.
Yeah.
This is very helpful. If any one of my colleagues have any questions from any of the committees, this would be the time. Seeing none, now we can open it up for questions with any of the panelists and people who have spoken who are still here. If anybody has any questions or comments, this is the time to speak to that as well. Going once, going twice. Okay, well, yes, I cannot thank each and every one of you who are here, members of the committee, the Children's Committee, Public Health Committee. You're very kind to make time, and then also each and every one of the panelists who are here. We want to thank you for your time and sharing your knowledge and understanding with us. We will have more conversations around this. We will not rest till we have a solution. We will collaborate with our federal delegation, but also work within the state agencies to make sure that we are trying to take care of the children. As I said in the beginning, when a child is hungry, parents cannot do anything. They cannot breathe, they cannot eat, they cannot sleep. And there are so many parents who are hurting right now in our state. And we who represent you have feelings, and because we are parents as well, we have experienced this ourselves, and we cannot imagine what you're going through, but we are there with you, and we will do whatever we can that is in our control to help address this as fast as we can. Thank you so much, everyone. And Madam Co-Chair, you have the last word.
I guess my last word is just going to be to thank you, Senator. You're always on top of these things. I appreciate you so much, and I appreciate everyone on the panel. So thank you.
Thank you. And I wanted to thank Dallas Emerly for his help. Thank you, Bev, for coordinating this. We truly appreciate you. And Bev, happy birthday again. Thank you. All right. Adjourn.